I decided to conduct an experiment today. We sent a camera crew out on the Hollywood Boulevard to ask people which they thought was better, the Affordable Care Act or Obamacare. Now, as you may know, Obamacare is just a nickname for the Affordable Care Act. They're the same thing. But lo and behold, we found people who did not know that, and that didn't stop them from weighing in on it.
We're talking about health care today, and which plan do you support, Obamacare or the Affordable Care Act?
The Affordable Care Act.
Affordable Care Act is more affordable than Obamacare.
Just the name says it all.
Right. Do you agree with the Affordable Care Act or Obamacare?
The affordable.
And why do you prefer the Affordable Care Act over Obamacare?
I just don't agree with the whole Obamacare policy thing that's going on. I just don't agree with it.
And do you believe that an informed citizenry is essential to a democracy?
Yes.
So what exactly is the Affordable Care Act? The Patient Protection and Affordable Care Act, otherwise known as the Affordable Care Act or Obamacare, was signed into law by President Barack Obama on March 23, 2010, and upheld by a Supreme Court ruling on June 28, 2012. The Affordable Care Act is a health care reform program designed to enable every American to have affordable health care insurance regardless of whether they have an existing condition, illness, or regardless of their gender. It allows each individual the ability to make their own informed choice of which plan is best for them. Previously, health insurance companies could deny someone trying to apply for health coverage if they had a pre-existing illness or condition. This new Reform Act came about because so many citizens did not have health insurance. This plan is to help reduce healthcare costs to the healthcare insurance system as well as for individuals. All people must have minimal essential health coverage beginning January 1, 2014. Otherwise, the IRS will collect a penalty. The purpose of Obamacare is to reform our healthcare system by expanding, lowering the costs, and providing health insurance for every American who needs it. It expands Medicaid to the 138% of Americans that are under the desired income level, as well as improves Medicaid and the Children's Health Insurance Program, otherwise called CHIP. Obamacare has been implemented in 2014, and there are many pros and cons to the new healthcare system.
Let's start out with the pros of the Affordable Care Act. Under the Affordable Care Act, Medicare has been improved for seniors. Some of the reforms to Medicare include reductions to Medicare Advantage, home health care payments, and Medicare hospital payments. Millions of seniors have already saved money or taken advantage of the no out-of-pocket costs for wellness and preventative visits. The Affordable Care Act also limits an insurance company from discriminating against customers. You can't be dropped from coverage when you get sick or make an honest mistake on your application. You also can't be denied coverage or treatment for being sick or charged more for being sick. You can't be charged more for being a woman either.
Young adults can stay on parents' plan until age 26. Many of these young adults are working and going to school but do not make enough to afford to pay for their own health benefits. Over half of uninsured Americans can get free or low-cost health insurance. Obamacare gives 30 of 44 million uninsured Americans access to health insurance. The average family has already saved thousands on healthcare costs last year alone.
We will now look at some cons of the Affordable Care Act. A major argument against the Affordable Care Act is that it increases taxes on various parties. Obamacare will force firms with over 50 employees to insure all of their full-time workers or pay a fine. In order to avoid these readjustments, businesses may cut employee hours or not hire new employees. Businesses may even find it more affordable to pay the fine, and their employees will have to purchase their own health care. An alternative would be that the business will increase costs of their products or services to consumers in order to afford the insurance for their employees.
With Obamacare, there will be an increased demand for health care with a low supply of professionals. A shortage among physicians will not allow adequate care to be given to all Americans. As a result, patients will have limited access to physicians, longer waits for appointments, and compromised quality of care.
Another negative aspect of the Affordable Care Act is that it will increase costs for consumers. In the short term, healthcare costs will increase due to increased coverage. More people will now have the insurance for medical screenings and testing. This will lead to increased spending. In the long term, costs of drugs will increase. Many pharmaceutical companies pay higher fees under the Affordable Care Act, so these companies will raise drug prices for consumers in order to afford the additional fees.
It is obvious that many Americans are not properly educated on what exactly the Affordable Care Act is. Therefore, it is our goal to provide the public with a general knowledge base of what this health reform is doing.
You know that Obamacare and the Affordable Care Act are the same thing.
No, they're not. Thanks, you made me look stupid.
It's what we do.
Okay, you did good.